It was a one George Bernard Shaw that once stated, the single biggest problem with communication is the illusion that it has taken place. And I think we can all agree that we can apply that quote to something that we've experienced in our lives where there was a miscommunication. I personally applied that to a circumstance in which I saw a staff member miscommunicate a discharge after an IDAT, which could have resulted in catastrophic happenings for our patient, but we were lucky enough to have escaped that. It was at that point that I took that experience and through a recent college course learned about a set of government mandated standards called the culturally and linguistically appropriate services, where no matter your barrier, culture, language, or other, you are provided the proper resources to receive the best health literacy so you understand what is going on and are able to be proficient and compliant in your care. I, at that point, took those standards, and while we may not be able to receive government backing, I thought we could surely implement these standards into our daily happenings, starting with the way that we deliver our discharges to our patients. We currently just have people come, pick up, hand them a folder of 10 plus different handouts. It's an overwhelming amount of information. Sometimes delivering this information in a lobby full of clients and animals where there's so many distractions. So to start with, I think the best thing that we could do is set specific discharge pickup times. So we have staff that is trained on the CLAS standards, as well as trained on our discharges proficiently and in a concise manner. The next thing that I think we could provide is take all of that information, the handouts that we have currently, and condense it down into one single brochure that accurately and concisely delivers our information in such a way that's not overwhelming to our clients and is an easy to read, easy to grab, easy to look at, and answers the most basic questions that we most frequently get asked. In proposing this idea, obviously we would have to sit down and discuss our current staffing issue. Do we have enough proper staffing? If not, we need to discuss a budget as to get more staff on board. We also need to send this staff for proper training on the CLAS standards and then take those standards, implement them into our facilities, as well as then train a more concise and efficient method of delivering our discharge information to our clients. We would also have to find a specific budget for new brochures, new materials, and handouts to disperse company-wide to be able to deliver our most concise health literacy to our patients. I personally think the breakdown in this particular situation opened a door for us to elevate ourselves to the next level and best level of veterinary specialty care. It's only when our clients understand and can comply with our message that we really are providing